Good afternoon, everyone. Thank you for joining us here at the New Jersey Cannabis Business Association's Lunch and Learn. My name is Scott Rutter. I'm a founder of the NJCBA and past president. I'm here today instead of our current president, Ed DeVoe. He's down in Washington, D.C. today doing great work on behalf of the NJCBA. Today, we're going to talk about Delta 9. Or Delta 8 rather, and what it is, what's going on with it, what the realities are, that it's fact that it's not regulated, but we're going to try to do a process of regulating Delta 8. And so we want to get to the truth behind it. And so we have this excellent panel here today. So I'm joined by my old friend and colleague, former colleague, Senator Declan O'Scanlan. Declan is a sponsor of the legislation that we're going to be talking about today. Declan, Senator.
Scott, thanks for having me. I appreciate it. Important work that I think we're doing collectively, and important topic to be talked about today. So looking forward to it.
For sure. And then we have your former chief of staff, current attorney, Bo is also a dear friend and has been really championing this effort for a very long time. Bo, you want to give a quick intro on yourself?
Thanks, Scott, and thanks for having us on kind of for this discussion. My name is Bo Huck. I'm Director of Governmental Affairs at Borzio Governmental Affairs and an attorney with Borzio, Bromberg, and Newman. This has been something that we've been tracking for the past several years, and wow, did it take off. And Scott, Brett, Leslie, Declan, everybody, thank you for actually giving us the attention it deserves.
Thank you, Bo. And to provide a little bit more emphasis to this, we brought subject matter experts in. We have Leslie here. Leslie, can you give a little bit about your background?
Yeah, thanks. And thanks for having me. I'm Leslie Engelking. I'm the founder of Foundation of Cannabis Unified Standards, or FOCUS, and we are a health and safety organization for the cannabis industry. So we've been working on the Delta 8 and synthetic issues across the country in different states for the past couple of years. And just happy to be here and have a discussion about it.
And thank you, Leslie. Appreciate that. And Brett, I've known you for quite a long time. You've been along this journey for cannabis legalization here in New Jersey from the beginning, and now you've been very much part of hemp-based products and things like that. And then you walked into this space where we're talking about Delta 8 and some of the things that are going on. So tell us quickly about your background.
So great to be here. Brett Goldman. I'm actually the chair of the NJCBA's hemp committee, and I've been in the hemp industry for almost 9 years now. Delta 8 and synthetic cannabinoids are a real wedge issue right now in our industry. And my partners and I at OCAN Group, we were intimately involved in crafting some of the language in the 2018 Farm Bill that allowed for cannabinoids to stay in the definition of hemp. This opened up the Pandora's box that we're in now with Delta 8 and other THC isomers being everywhere. 5 years ago it was CBD, and we were very happy for that. And I don't think anybody really saw this issue coming down the pike because the FDA was supposed to regulate cannabinoids, and well, they still haven't done that yet. So we're in this difficult spot that we're in right now.
And right on. And I think when people started to hear about Delta 8 a couple of years ago, we really didn't know what it was. And people were talking about Delta 8 as being, well, it's a little bit lighter than, it's sort of like CBD, it's sort of like Delta 9 THC, but it's not, you don't get as high. Like that's sort of like a general conversation. So we know that to be different. We'll get into that in a little bit. But Senator O'Scanlan, I really want to get more meat and potatoes behind your legislation and what you intend to do with it.
Well, and Scott, you kind of hit the nail on the head. We still don't know what's in these products. So we know what they are. I guess we have a better handle on that. We don't know what the hell's in them. There's no testing. We've seen some random tests done where the contents are all over the place. So that's part of the problem. It's unregulated, untested whole area of this industry. And Brett, that was interesting. You mentioned how when you folks did the original language for the bill, you just didn't foresee this happening, certainly not without the FDA stepping in. And it's amazing that they have not yet. So I think that's an important distinction. The people who put together the legislation, the I'm not sure you could point to a mistake that was made. It's the follow through at the federal government level that's a problem. And that brings us up to the legislation that was at the time, Bo was my legislative director. We sunk our teeth into many aspects of cannabis legalization, medical cannabis, medicinal cannabis. We were involved in those things throughout to try to make sure that that it was done right. New Jersey did do much about medical cannabis right, including some of the pioneer testing and developing testing that I don't think existed before New Jersey was a forerunner. And it's a shame that we did not expand medicinal, and I know I'm getting off topic, but it breaks my heart that we didn't expand medicinal before we went to full legalization, because we were on the cutting edge of a real clinical medicinal program. So I think a lot of that opportunity was lost, but we'll talk about that maybe another day. We'll come on to do that. So we, one of the next things on the list was as Delta 8 and these other synthesized hemp-derived products started to get on the market, you got to pay attention. And you saw these things popping up everywhere, and kids using them, et cetera, totally unregulated. So we followed that for a while, and then realized the federal government wasn't going to do anything. So we put together a very reasonable bill. We're not, necessarily banning anything, but we're giving the CRC the ability to regulate. They have, the tools in place to do that. So that's what we envision. And there needs to be, this genie needs to be put back in the bottle, as hard as that might be.
Yeah.
Because, and Brett mentioned just before we went on air, the number of people, I'm sure we'll get back into it, the number of medical episodes that we hear about. He probably go into, children as well, because they can go in and buy this stuff. It's a problem. So, and it isn't just THC levels, it's all the other chemicals that end up in these highly synthesized products that, again, I don't think anybody really knows. And there may be some that are reputable companies that are producing product that's consistent, but you don't know. And there's 12 of them on the shelf. If
Right.
one or two of them are those, we don't know it. And it's dumb luck if you buy the reasonable ones, or the ones that are going to do damage to your lungs or God knows what. So that's how we ended up here. Bo, before he moved on to bigger and brighter career aspirations, we put together this bill, and we're proud of it. I think it's a good way to go.
Well,
Bill, you want to add to that?
This discussion started in 2019, where you've always been a real good patient advocate. You've been a consumer advocate for safety. This is kind of where your heart was always in the cannabis space. And you were trying to figure out, hey, like, what's the best way we can really open up a marketplace to make sure that it's a sensible and safe and affordable industry. And I remember saying, have you ever heard of hot hemp? And I'm like, I just heard about this thing. And it was like, what the heck's that? And I explained the 2018 Farm Bill, and it was like, well, we can get to it when let's see if the FDA does anything first, because this is their purview, this is their charge, this is what they should really be doing. And this litigation had ensued at the federal level that really opened up the door to this. And fast forward, the pandemic hits, Fed's on autopilot, they're not putting any type of regs out, and here we are today. This past summer, we kind of revisit the issue a little bit. I've been out of the office now for a couple of years, and I still haven't done anything. And we're thinking, it's a good size marketplace. We have no idea how big it is. And just recently, the Brightfield Group comes out with a report saying it's a $2 billion national marketplace. The toothpaste is out of the tube. It is horrifying, because once you hit that critical mass, it's really hard to pull back. Where New Jersey is, and the states are just generally, is we're kind of left on our own to deal with this bit of a Frankenstein's monster here, because there's probably a place for it in maybe an adult use marketplace or medical marketplace, but to have no guardrails in place at all, what's really so dangerous. And meanwhile, it's an existential threat potentially to an entire adult use and medical marketplace, because this is complicated stuff. Reporters constantly mistake adverse events in cannabis for it was a cannabis product. No, it was a Delta 8 product, or it was an isolate product. Some kid got this package that looked like a bag of Doritos and consumed it, or a school bus driver took some and crashed his bus. It's actually happened. And this legislation
And worse.
and
Yeah,
worse.
And worse.
And this legislation was just kind of a starting point as far as the discussion goes, to say, well, we need to do something. Let's at least give the most educated regulator in the state the ability to potentially pump the brakes or come up with a framework if the feds fail to act in the 2023 farm bill this year.
And Bo, I think it's important to mention that everybody on this call is pro cannabis. Everybody in this discussion is pro cannabis. We're not looking to take away access for people for cannabis products, but we want to make sure that they're getting safe and reliable products.
Right.
And with this Delta 8 stuff, it's unclear if it's safe. I mean, Declan mentioned this, Bo mentioned this, Leslie's going to get into this, but there are things that are used in the manufacturing process, a synthetic conversion of CBD into Delta 8 that produce cannabinoids that did not exist previously in nature.
Right.
And for that to be sold as legal or as freely as can be,
so let me
that's a problem.
Right on. And let me use that as a segue. So in preparation for this call, I went and bought this Delta 8 vape pen at a reputable convenience store in my town. It looks just like, it's got the barcodes, it has an FDA disclosure form. It looks like somebody did test this. It looks like somebody is regulating this. It looks like something that is providing some level of enforcement to ensure quality control. I mean, we all remember the vape crisis in 2019. People died. People were actually dying or having permanent injuries to their lungs because some people put chemicals that should never go inside of our body into the process here. And we really don't know what Delta 8 is or how it's being produced. So Leslie, tell us.
Degradant products, Scott, I think is the word.
So Leslie, give us a little bit more background from your perspective on the concerns that we should all have.
Yeah, this is a great lead in. Thank you. I think it's these chemical conversions that are the challenge. It's not even necessarily Delta 8, but we just don't know. There are a lot of other chemicals that are made in the downstream process of creating Delta 8 and other synthetic products. And we don't have the methods in the testing labs to identify this. So similar to if you were going to go and get tested to, your urine tested to see if you'd use different products by your physician, right? And if you're clean, you have to know what you're testing for. And so really the only way to identify these things is if you're looking at the actual chromatogram and not a certificate of analysis. And when you do that, you see all these other unidentified peaks that come up instead of just the curve like we would normally see for the THC. There's a lot of different peaks. We don't know what any of those things are. We do not know what the long-term effects of those are. We don't know if they cause cancer. We're not even sure what all of them are. And so I think it's important to understand that what's happening in these manufacturing facilities is a pharmaceutical process. And that means it needs pharmaceutical controls. This is no longer a cannabis product that has this history of a safety profile that we can all trust and depend on, right? This is now a chemical product made in a pharmaceutical manner that really needs that. And I think this bill is super important because we can't change anything we can't measure. And if we don't identify what is out there, how much, and give consumers some safety guardrails to purchase this stuff, we're going to end up in a world of hurt in 10 years down the road when we find out what the actual problems from these products cause.
And that's usually the case, right? And technology gets out in front of government. Now we have new products that are coming out in front of government, and it takes a while. I mean, it's a very deliberative process. As Senator Scanlon and Bo know, when you're going through this process and you have to gain allies and support, there's other people who have different opinions about different things. So it necessarily takes a long time. So Senator, what are your sort of expectations on how we can get this moving forward and getting more people engaged?
Well, look, this is one where I think that our timing was right. And we see some momentum happening. I mean, the federal government, I'm sure because I introduced my bill, because of all the power that I have as a minority member of the New Jersey State Legislature, when I introduce a bill, it has national repercussions. But within
Actually,
days of the
international.
introduction of the bill, say that again?
Actually, it was international. I believe the introduction of your bill hit international press.
It did. And I'm sure it was a direct result of that the federal government started talking about this. I mean, Bo and I were exchanging links. It was amazing. So they're starting to talk about it at the federal level, Congress. They're talking about the new iteration of the Farm Bill to deal with some of these things. So it's got some momentum. But you also saw we got some attention here in New Jersey as well. So, and Scott, with your help, I think we will end up with some members of the other side of the aisle embracing this, because we're not overdoing it, right? This bill wasn't designed to just get PR and then die. It was designed to be a very reasonable solution and give power to CRC rather than, have me just guessing and banning, et cetera. So I'm hopeful we can move it. And it won't be one of those things that collects dust on a shelf. And look, it's urgent that it move too. It's, God knows, any day now, there's going to be a tragedy when one of these products hits the market, or a batch of products are delivered that are going to do some real damage to our children, and the adults that use it.
With no recall.
So there is a sense of urgency here. Say it again.
We've already seen that happen.
Yeah, that's already happened.
We've seen that happen already. And the Poison Control Center for the US did a presentation about Delta 8 for a Food and Drug Conference in June and had already reported a death. And I think there's been a few since, the kids that get into this stuff that don't know what it is. And it's attributed to cannabis as a whole. I think that's an important thing really for the industry folks on the line to understand, is that this is damaging the reputation of the legal market just as much as the Delta 8 market, right? They're not separated in a consumer's mind. People don't know what we know.
And that's true. I know that I can feel the cringe out there when people hear anybody talking about regulation, et cetera, within the legal industry as well. But this is an area where you need it. I mean, I think Brett and Scott mentioned what vitamin E acetate that was in vapes decimated that industry, decimated the legal ends of that industry. You maybe are seeing it happen to the cannabis industry, or you will, if you see, mass deaths. Again, if you could easily get a batch of this stuff that really becomes frontline, national, international news. It would devastate the greater industry that is being responsible.
And Declan, a lot of these products like THCO acetate, which is freely sold in these stores, may spark the next Diwali crisis. You shouldn't be vaping unknown substances, and this is exactly how it's being sold.
Yeah.
Go ahead.
No, so there's a question here, and I want to make sure we capture something really important for Senator Scanlon and Bo. People want to be assured. So people on the pure cannabis side, right? So which includes THC, CBD, CBG, all those cannabinoids that we know, that we trust, we understand it. That this in no way, shape, or form will go after those types of products. Correct. I mean, this is specifically Delta 8, correct, Senator?
Well, this adds authority to the CRC to regulate this specifically. They already have the ability to regulate everything else, and that's what they're charged with. So, we did not prescribe, specific regulatory action on purpose. It should be left up to the folks that have the tools. So, yes, that is a fair distinction, but in absolute terms, no, this shouldn't change anything. Right. But give the authority to the CRC to regulate these products.
And this also isn't. There was a question in the chat, about whether or not this is coming after other hemp-derived cannabinoids like CBD and CBG, and the answer is no. This is not about CBD or CBG. This is specifically about intoxicating cannabinoids that are being sold as sold outside of the regulated
in,
ecosystem.
in a very unregulated, unsafe environment. And I think, Brett, one of the things that you sort of captured there was that Delta 8 does not exist in nature.
Yes.
Other cannabinoids that we do talk about.
Let me clarify that for a second.
Right.
Delta 8 exists in very minuscule amounts in nature. If you're going to get it at scale, you have to convert CBD into THC. Delta 8 flower is not actually a thing. When you buy Delta 8 flower in the store, or when you see it advertised on the shelves or go to these cannabis shows and they're selling HHC flower or THCO flower or THCP flower or whatever, that's usually hemp flower sprayed with distillate or something else.
The things that we're concerned about, right? The things that we don't know and understand what's being sprayed. And there's not a consistent way to do it across when there's a standard industry platform for which they can follow.
Exactly right.
And, we've kind of talked about this a little bit already, but my day job as, lobbyist and lawyer, and on the lawyering side of things, I deal with cannabis, and I review a lot of SOPs for safety procedures. Well, when we look at something like this and we see applicants going into the regulated marketplace that are trying to do all these different right things that the state currently requires them to do, and they have a strong commitment to their communities and to the state to try and adhere to that. With this stuff, it's got nothing like that. You can market it to small children. You can, you don't even have to actually have the product you claim to have on the bag of edibles in the actual bag. It could be cough syrup for all you know. And, that's really what drives me nuts, because it only takes one or two bad actors. Because I bet you most people in the cannabis isolate space are trying to do the right thing.
Yep.
It just takes one or two real bad instances to cause a lot of harm to reputation, not just that industry, but the adult use and medical industry as well. And also, too, most importantly, people.
I think that's what, we go back to 2019 and the vape crisis that occurred there. There's a lot of different things happened, but it really did boil down to a couple of guys in a warehouse trying to provide a little bit more texture to the vape pen and the oil that's in there. And they had a big barrel of vitamin E acetate, and they just mixed it, because you can put vitamin E acetate on your skin as a lotion. It's good for your skin as a lotion. It is something that is approved for skin as topical use, right? It was never intended to be inserted into some oil product that you were then going to absorb into your lungs. Never. So they didn't mean to cause the danger and the deaths and everything else that happened, but it happened because there is not a standardized process. Leslie?
Well, and that's a great point,
Senator?
Because in order to create Delta 8 at scale, which Brett mentioned, they're experimenting with all kinds of different chemicals that they may not even be bad actors. It's just, hey, we tried this one, let's try another one. And okay, those haven't killed anyone, let's try another one and try to up our efficiency. So you could have someone, again, not with not the intention to kill a whole batch of people, do exactly that.
Well, and it's not just, sorry, Leslie, you want to go? No, I was going to say, and it's not just the vitamin E acetate issue. There was a lot of research that was thrown around back in 2018, 2019 at the height of the vape crisis. And when the FDA, kind of fingered nicotine vapes, they looked in that direction. They kind of crushed the e-cigarette market, but they missed some of the actual problems. When you're extracting stuff from a plant, whether it's cannabis or whether it's nicotine or whatever, it's going to concentrate whatever chemicals are used in the treatment process, in the cultivation process. And, there's a lot of thought that, pesticide like Eagle 20 or mycobutanol got concentrated in these extractions, didn't get cleaned up. And when you heat that at a certain temperature in a vape, people get hurt, people get sick.
Leslie, I saw you wanting to join in here.
Thank you. A couple of things. One, as far as, heating stuff up and putting it in your lungs, I mean, water is, is considered generally recognized as safe by the FDA. But if you put it in your lungs, it will kill you, right? And so the intent of what we're doing is important to understand. And I think, honestly, the comparison between what's happening with these synthetic molecules in cannabis right now and the vitamin E acetate situation with EVALI, from a few years ago, it's actually better compared to what happened in the 50s and 60s with thalidomide. It was a drug that was being used around the world. I think there were like 25 different countries that legalized it, Germany being the prominent one. It was used for anxiety and depression and sleep disturbances and morning sickness. And within a few years, we had all these babies around the world that had birth defects because we just didn't know, and the research wasn't there. It was never legalized here, but I really truly think that if we're looking at where this could potentially go, we need to look at a situation like that much more than what happened to some businesses in the vape thing, because it will crush. I mean, there is not thalidomide on the market today, so there's bigger implications too from a public health and safety perspective that are really not being addressed. So I think this is, like I said, this may not be the perfect fit and it may not be the be all end all, but I'm super pleased to see some efforts coming to control this, because if we don't start somewhere, it's just going to get further out of hand,
And let's be honest, the real issue in cannabis, with all of cannabis, whether we're talking about, THC products or hemp products or CBD products or all of them, is the lack of federal standardization and real tangible federal framework, which is something that Leslie and I are working on.
Awesome. And well, and thank you for that too, by the way. And Brett, I know you guys, you and Leslie and others have been working hard at the federal level for a very long time, and a lot longer than you should have, right? This should have been done a while ago. These regulations should have been placed a while ago. We shouldn't be guessing on these things. But Senator, that's where your leadership comes in. And for those who don't know much about Senator O'Scanlan, well, he and I actually started in the state legislature together back. We both got elected in 2007 to the state assembly. But Declan's a purist. He is one of those folks out there, feels very pure about this. He went out to Colorado. He's not a cannabis consumer. He went out to Colorado. He went and toured facilities. He asked questions of elected officials, law enforcement, Department of Health people. He really started to embrace this because it's not something that's personal to him necessarily, but he sees in his constituents the benefit of medical cannabis. And so he's always been a leader in this discussion. So thank you, sir, for what you've done in the past. But that's also really critical for what we're doing today. And we have to keep that open aperture there, because things like this will pop up again. And you leading these discussions and developing the framework to help regulate this, because it's not about hurting a business. What it is about protecting the people, safety procedures.
Well,
and that's
ultimately
something
protecting those businesses. If there's if this continues to foment tragedy, or we have national headlines of tragedy, those businesses go away, the legit ones too. So it's both. But thank you, Scott, for the kind words. I appreciate it.
And that's something that the federal government hasn't taken responsibility on, is consumer health and safety, especially when it comes to cannabis products. There are a handful of there's been warning letters put out for 7 years, 8 years now from the FDA against some CBD products and other cannabis products. But those warning letters aren't enforcing against quality or safety. They're just saying you can't say that CBD cures everything from cancer to headaches. You can't say.
Meanwhile, we have CBD, which has an incredibly clear safety profile forever that they can't get over. And at the same time, we have this prolific explosion of all these unsafe products. The intention is not being put on public health where it needs to be, for sure.
And you can, look, you can draw a straight line between the decline of the CBD market in 2019 and 2020 to the rise of the Delta 8 market in 2020. CBD, and as somebody that's kind of been at the vanguard of the CBD industry for the last 9 years, was supposed to be regulated by the FDA. There was supposed to be a pathway for CBD products into food, beverages, dietary supplements, and, mainstream consumer packaged goods. That never happened. So when that didn't happen, there was no ability for the, large food manufacturers, large CPG companies that wanted to play in the space to be able to take CBD and put it into products. So the price crashed. The price crashed because of overproduction. The price crashed because there was no regulation. And all of these farmers, all of these processors that had, whether it was hemp or whether it was, CBD isolate sitting around, basically collecting dust, had to find a new market for it. So price of CBD went down, Delta 8 goes up.
And that's where folks who are creative folks are looking for another solution. What can I do? And we love that. We love the innovation, but this is one of those areas that has a very serious consequence. And so unless it is regulated, unless it is tested. We're going to wrap things up here. Leslie, I want to give everybody sort of last minute conversation here. So Leslie, what are your thoughts on this, where we're going?
Gosh, I have no idea where we're going. I mean, I'm literally in discussions with 14 different states through their, cannabis programs, hemp programs, or legislature right now. There isn't a perfect way out of this. I mean, we're in a pickle. But I think this is the right way. I think consumer education around this issue is key. And we got to take incremental steps. So I applaud everybody in New Jersey for doing this. We've got other states that actually let these synthetics into their medical program. And so their products on the medical side now have THCV, THCO, HHC, Delta 8, Delta 10A, Delta 6A, and patients are scared because they don't know what that is, so we need to do better for the consumers because they're the ones who keep everybody in business.
Right on. Bo, do you have final thoughts?
In New Jersey, there's been a few major cities. Jersey City tried to pass an ordinance regulating this, doesn't probably go far enough. A couple small municipalities have tried to address this. Some states have a process. New Jersey has zero here. Connecticut just yesterday put out warning letters as far as this industry goes, and it's a real concern. I am optimistic that some colleagues on the other side of the aisle that are very health conscious are beginning to pay some real attention to this. But ultimately, if this bill moves forward, it's got to, get the governor's attention a little bit on it, because as he said in the past, economic health or public health is economic health. This is a public health issue. This is something that could blow up in all our faces very bad. And we owe it to the citizens of New Jersey to try to address this in a safe, responsible, and not overreactive manner.
And right on, man. And cannabis has always been, it's always been a medicine first. It's always been a medicine first. And again, that's why, Senator Scan, I think you just jumped right in here because you've seen how medical cannabis has really helped people, whether they're dealing with pain issues, anxiety issues, seizure disorders. So you've been a champion of this. And again, we thank you for this legislation. How would you just top this off?
Yeah, look, I think we have a real shot at getting this done here. But I think everyone said on this call, ultimately the federal government has to take action. And there's certainly overwhelming evidence that they need to, as we've covered already. I still want to move our bill because I think it's just going to take too long for them to get regs into place at the federal level. We need to start somewhere. It may as well be here in New Jersey. Again, we were a leader in testing. We were a pioneer in testing of these products when we started our medicinal program. One could say what one wants about the Christie administration's rollout of it, but because of their insistence on some clinical levels of measuring these substances, we helped the whole industry move forward in testing. So it would be reasonable in New Jersey to once again lead the way on these categories of substances. And look, they should start by banning them for a period of time until there's testing. So that's something that probably should happen. But again, I'm not gonna dictate that. But I think we do have some momentum. We've seen it from members of the legislature. We've seen it in the press. There's real interest, and I hope that the administration, and I will be in touch with them, will embrace this. Because look, anyone who doesn't runs the risk, at the next wholesale tragedy of being accused legitimately of being asleep at the switch. So there's the threat. There's the carrot and the stick.
And products coming in from out of our state impacting New Jersey.
Oh yeah,
and
this
out
was
of the
not
country too.
Yeah, out of the state, out of
Yep.
the country as well. And this product right here was not produced in New Jersey. It's sold at a convenience store where they're not going to check IDs in a town that has opted out of cannabis dispensaries, right? So,
Well,
so just about anybody can walk in here. So final word, Brett. What are your thoughts? And then we're gonna wrap this up.
look, so I want to say a couple things. You know, we've Bo, Senator O'Scanlan, Scott. I mean, we've been having these, Leslie, we've been having these discussions since probably 2016, and the discussions evolved quite a bit. Now we're, you know, when the 2018 Farm Bill was on the table, you know, we had a lot of discussions about what that's going to mean for the hemp industry in New Jersey. Now we're in a situation where the 2023 Farm Bill is on the table. And the 2023 Farm Bill, you know, there are expectations that it will address some of these issues regarding synthetic cannabinoids and synthetic isomers. But that's not guaranteed. Right, exactly. That's not guaranteed. And so, you know, we have to continue advocating both at the state level and at the federal level for closing that loophole. And, you know, look, I mean, the DEA, they've got bigger problems than cannabis, and that's great. But
Well, and they're
we
not
still-
even supposed to go after it anymore,
and-
right? I mean, it's
and-
hemp and it's legal and there's been court decisions. So DEA isn't coming after this or the illicit market like they used to. I mean, people have to recognize that, I think.
and the illicit market continues to thrive, and the regulated market continues to struggle. And, you know, again, unless the Farm Bill can close some of these loopholes, it's going to be up to states like New Jersey and legislators like Senator O'Scanlan to lead this charge in, you know, leading where the feds haven't. And,
Right on.
you know, that's just an unfortunate thing that's happened with cannabis legalization in this country. And, you know, if we're not careful, I mean, you guys hear me say this all the time, the rest of the audience doesn't, but, you know, we're going to mess it up. And the rest of the world, some other country is going to lead and do better than us. And that's just really,
People
that's
would
just
always
really upsetting.
rather follow American standards and the American way of doing things. But
Yeah,
unfortunately, as a country, we're just not stepping up and showing the leadership we need to in this space.
That's why we need to set the standard, and Senator Scanlon, you're helping to set the standard state by state, with New Jersey leading the way. So again, thank you all for
Now, most importantly, go Eagles. Go Eagles.
definitely go Eagles. I mean, we all know this is Eagles country, but no, but seriously, guys, I really do appreciate your time here, Senator Scanlon. Really appreciate your leadership on this issue.
Thanks, Scott.
And here we go. We're going to wrap this up. And again, there's a lot more work to be done. Legislation introduced is not a law. So there's a lot more work to do. And so we're going to continue to build a coalition and get this thing done.
And for the people on the call,
Man.
for the people in the audience, call your assembly member, call your senator, call your legislators, and tell them that we want to clean this up and we want to deal with this, and we want to make sure that there is a safe market and that cannabis is safe in New Jersey.
Right on. All right, guys. Thank
Thanks,
you
everybody.
very much. Jenna,
Thanks
Russo in the
all.
background there. Thank you for pulling this all together.
Thanks,
Thanks,
guys.
guys.
Have a good weekend.
Take care.
Go
You too.
Birds.
Go Birds.
Go Birds.